in our hands and wrists can really affect daily activities. Arthritis is one of the most common forms of hand or wrist pain, and the right treatment is key. Joining us live now with more on what to do with those treatments, Dr. McCarthy. He is an orthopedic hand surgeon with Hartford HealthCare Bone and Joint Institute. Doctor, thank you so much for being with us.
Thanks for having me, Kara.
Tell me a little bit about what we need to do as far as treatments.
So the treatments sort of range the typical non-invasive things like anti-inflammatories, be it topical or oral. Sometimes there are steroid injections we can use even in the hand and wrist, although they are small joints, similar to like hip or knee arthritis, which people tend to be more familiar with. And there are plenty of surgical options that sometimes patients either elect for or need to help treat definitively their surgical or their arthritic pains.
So how do we know if we really need help? I mean, sometimes I get pain in my thumb here, probably because we're texting too often. How do we know if we need to go see a doctor like you?
I find it's really based on how often it's bothering people. I mean, if it's a once in a blue moon sort of thing, that's probably not much to worry about. But if it becomes a type of symptom that's present either every day or most days of the week, it tends to be something that we recommend getting checked on, so at least we know what's causing it and what the potential options may be.
And important for people to know that arthritis in our hands and wrists doesn't always mean surgery. What else would you do if it's not surgery?
Yeah, certainly there are medications that can be useful to help keep the pains at bay, either over a short time or sometimes even long-term medications that can help keep the pains away. Like I mentioned, there are steroid injections and things of that nature that can be done to help keep the pains away, importantly, among some other things, depending on the specific joint or issue in the hand or wrist, as there are a lot of them.
Yeah, how quickly does arthritis progress in our hands?
It's usually a slow process over many months or years. Although if patients have had trauma, such as fractures in or around joints that didn't potentially heal properly, or infections sometimes in or around the joints, that can make the arthritic process happen much more quickly, maybe even over weeks or months instead of the years.
And real quick, I know we're running out of time, but just yes or no, are we seeing an increase because of the use of technology?
Probably not, to be honest.
Okay. Thank you. That's good to know. It's not, maybe we shouldn't text so much, but it's not causing people's arthritis. All right. Doctor, thank you so much for being with us. And for more information, everyone, you can go to hartfordhospital.org/BJI to get some more information.